One of the guiding principles our team has followed in designing Maximize.com is simplicity and usability. The system should be easy to use, but also powerful, providing you with the necessary tools to take care of your patients. That's no less true in the billing section. Here, our team has worked to create a simple view that works for both the front desk as well as your office's biller. On the bill, you see all the patient's insurances listed. It's easy to remove any insurance that isn't relevant to this visit without affecting the patient's record. You can also add missing insurances from here, reducing time clicking around trying to correct errors. Diagnosis codes pull automatically from the encounter. Otherwise, they can be added directly on the bill. With our ICD code selection tool, it's easy to see the history of codes for a patient or search for any diagnosis code to add. The tool helps you select the most relevant code by prompting for specificity, stage, and laterality if an unspecified code is selected, ensuring you use proper coding. The same goes for charges. Billing codes pull from the encounter as well as optical, or can be added directly on the bill. The Type to Search function quickly filters the list of available codes, helping you select the correct one. Each line can individually be assigned to a particular insurance or to the patient, or you can assign all lines. And when it comes to creating claims, only those charges assigned to a particular insurance will appear on that claim. You can have a single bill for the patient's visit, with exam charges going to medical, optical charges going to vision, and a second pair of glasses billed to the patient. Additional information that isn't relevant on every bill is easily accessible through the bill details. From here, you can enter information necessary to bill post-op co-management or workers' comp claims. When it comes to taking a patient's payment during the checkout process, our simple Quick Pay screen allows you to see the total outstanding balances for both the patient and the account, helping you collect all open balances. This screen can be accessed from the patient's record, during the optical ordering process, as well as here on the bill. As for insurance payments, our Insurance Payment Manager pulls in electronic remits from the clearinghouse, as well as allows you to manually enter remits from those payers you receive in the mail or through the payer's own website. Control the details of the payment when entering it into the system. Set the type of payment, reference number, amount, and differentiate between the date on the check and the date of deposit. After adding in a new payment, you're brought to the posting screen. Our philosophy here is again to keep things simple. When posting insurance payments, everything should be available up front to prevent you from having to navigate to other parts of the system just to complete your posting. By default, open balances for the selected insurance are shown in the list on the left, but you can use the search function to find any bill in the system regardless of insurance assignment or balance owed. When it comes to posting, you can enter the amount paid per line item or enter the total amount paid on a bill to allow the system to distribute the line items. If you've run the benefits calculator, the insurance expected totals should match up with your remit, allowing you to post quicker. Now, what happens when an insurance is missing or incorrect? As mentioned, you can look up any bill in the system while posting, regardless of insurance assignment. To post a payment to that bill, just reassign the charges to the insurance you're currently posting. If that insurance is missing from the patient's bill, you can see all insurances this patient has at the bottom of the screen and simply use the blue plus to add it. If the insurance isn't even on the patient's record at all, the purple plus allows you to add a new insurance right from the posting screen. Think posting a Medicare Part B payment where Medicare tells you they've forwarded the claim onto the secondary, but you weren't aware of any secondary insurance. With the Insurance Payment Manager in Maximize.com, you can correct this without leaving the posting screen. If anything about the remit information needs to be corrected, say the deposit date was entered incorrectly, it's just as easy to modify the details. Any modifications are recorded in the log so you know exactly what was done, by whom, and when.